coming with the white coats. Dr. Hoa Nguyen from the PAG, the Physicians Advisory Group. We know they had their Thursday night meeting. So spill the beans, Doc. Good morning.
Morning.
There's no bean to be spilled,
Oh,
guy. Good
come on.
morning.
Come on. Okay, bye. See you.
See you later.
Anyway, we have a relatively short meeting, but it's very good. The numbers seem to go down. Still trending a little bit downward, but more stable now in the 30 every day. We wish it get lower, and hospitalization is also trend downward. We lost some people, but at least we don't have a lot of new admissions. So I think this morning we stay at 40 in the hospital right now. So that's the lowest number we have in the last 3 to 4 weeks, and only 8 in the event. Before this thing over, we probably lose a few more people, but at least it's, the rate of a new admission is coming down, and we keep our finger crossed. That's the way it is. So we talk a lot about how to move forward, because we stand still peak hole one now for quite a few weeks already. So and the number that we have right now is comfortable, but we need to improve and get it lower. And the most important we have right now to move forward, even this surge or the future surge, is that we really have to look at the isolation, the contact tracing, because if we going to have someone that turn positive, we really like to come up with some metric that we can measure how long does it take for the public health isolation team to start to contact the patient. It's very important to Chima set a goal in less than 5 hours of positive findings. So we're going to ask public health to report metrics probably every week to make sure that we know that the isolation contact tracing is not behind. We know they're behind, because there's a huge surge and the process of hiring contact tracer and the extra staff that do demand the isolation contact tracing is I don't know, it's complicated its own ways, but we need to kind of beef that up, because this is the only way that we keep ourselves from have a recurring situation we have right now. So that's we're gonna ask for some hard number, and we're gonna ask some metrics to do the for the isolation contact tracing. Let's see what percentage people we contact on time. I think the goal of less than 1 day, 24 hours, is a reality that we have to really push. So that's what we talked about. And
You said
let's see if public health can present us number.
you said Dr. Hoa that Uchima said the goal is 5 hours. Do you know? Did he say on average how long it is currently?
We got a comment that a lady is in a household with a known positive, says public health took 8 days to contact her.
Yeah, that's we don't have the number now, guys. I mean, we really, it's that's something we ask really. Once you have a positive finding on a patient, and either at public health lab or DLS lab or at the private clinic, we want to know what happened that positive. Someone, because we fax everything to one number, and we just wonder what happened when we fax and the number land on someone's fax machine. Where does it go from there? The most important thing is isolation. That's what public health need to get on it, get the phone, talk to the patient right away. That's the initiation of the contact right there. The contact tracing will take a day or two, is okay, but at least the first few hours that you find out you're positive, someone need to contact the patient right away. I think that's something very important for us to move forward from PCO 1 to PCO 2 because that's the most important things, But yes, you're correct. There's quite a few patients that we noticed that after 3-4 days that no one even make attempt to contact them yet from public health. So but in order for us to move forward, there's a matrix that they have to present to the PAC or to the governor that, hey, we have 32 positive. We're going to contact the 32 positive within 6 hours, 12 hours, whatever. They need to present those data for us, so that way we know that, hey, we have an adequate isolation team, adequate quarantine team, and a contact tracing team. All those teams need to put together, and they need to report those numbers for us to feel comfortable to move forward.
Doc,
Right.
can you talk about? Go ahead.
So obviously it's an issue. So because you guys are talking about it and you're talking about how and Nuchima is saying that the goal is 5 hours. So I would think that the PAG would know how far behind they are in terms of how many days. And so how many people are on this isolation team that it's a responsibility to call and let people know that there's a positive?
Yeah, that's what we try to find out.
He didn't have the
right
answer?
Now we have no idea how.
Chima
we
didn't
don't
have an
the
answer?
number, how many isolation staff. But we're going to ask them, and we have to give them some time to give us an answer. But we really expect them to give an answer on how many staff on the isolation team, how many staff on the contact tracing, the quarantine team, the investigation team. So those numbers need to be out there. If we are short of staff, then it's time to hire. I know that because the number go up so fast, naturally everyone's going to be behind. But to be behind and identify that you need help and ask for help is important.
Mm-hmm.
So we need to get those numbers to correlate with the current situation that we have. Like I say, in order for us to go forward, it's very important. Those 32 positive. I tell you that we have yesterday. Those 32 should be someone should call them already, and that's the goal.
Right, and I think that's interesting, Doc, because we're not. I feel like our reaction and our response to the virus is not at a level that maybe is appropriate for the outbreak and the widespread transmission of the virus. It's more of like what public health can handle, right? So instead of doing the mass testing, which is a key trigger in moving from PCOR to PCOR, we said, we can't do the mass testing because we got backlog. So now we're only going to test 200 people on a random weekend in Umatic. And then we're also seeing with the daily testing, we only tested 175 people yesterday. So to me, it seems like we've tailored our response to a manageable workload for public health. And I'm just not sure. And we'll ask public health from a containment standpoint, is that adequate to, do what we got to do to starve this virus? I mean, I understand we don't want to get drowned in too much work, but at the same time, it's like if the governor has his transfer authority and all this power from this health emergency, X-ray vision, superpowers thing, then why are we moving more personnel to make sure that we can do things like test a bunch of people like we need to, or, contact trace? We just got another comment in here. Lady says after day 5, no contact from public health. They finally responded after multiple calls on, I want to say, what does this say here? On day 12. Yeah, so again, we're hearing that public health's just in over their heads.
It's just where, if you don't isolate the positive right away, there's a chance of transmission to other people. So it's so important, at the clinic level, we tell people that, hey, the one you're positive, please stay home, isolate yourself, and public health will contact you for the day or two. We tell people that, but it's very important that they have a call within 24 hours. I tell you, this is so important because some people would like to be moved to an isolation facility because the household good is too many people in there. It's not adequate for them to isolate themselves. So if any delay within a day or two, potentially the whole family will get infected. So it's
Doc,
important for
Doc,
them to do contact right away.
just for clarification, so the isolation team, this is the team that contacts people after they test positive and let them know that they are positive and tell them to isolate. Is this
Yeah, that's the first move. It's
okay?
basically they need to call the patient.
That's the
and kind
isolation
of,
team.
Yeah, that's isolation team. They have to contact the patient first and kind of talk to the patient, get some demographic, how many people in the family. You need to be moving out the family, your house or not. That's important, and then the contact tracing will come after that, and the investigation
Right.
team will come after that.
So
With
how
the
can
initial one,
we
isolation.
how can we expect this COVID app alert to work if we're telling people that they're positive 12 days later?
Yeah,
It's-
guys, what's the app does is that the Guam COVID app does is that, let's say you positive, okay,
yeah,
and
but if I'm finding
you
out
will contact public
8
health.
to 10, 12 days later.
No. It's this. Listen a second. If let's say you find out you're positive, let's say I tell you you're positive, right? So you go to contact public health. They do what they do. They give you a code. You put inside your phone. You put that code on into your phone, and immediately it send out on this signal to the people that come in contact with you instantly. If you spend 15 minutes around you and less than 6 feet, those people in the last 2 weeks will have a ping on their phone say you've been coming in close contact with someone positive. So that kind of bypass the call, the contact tracing. So if I be close to you and my phone ping, my phone would tell you, hey, you've been in close contact with someone positive. This instruction you need to do. Call public health, call your private clinic or whatever. They give you instruction there, so it cut down the time that the contact tracing, because contact tracing might take several days behind, but that app was cut down the time a lot. So by the time public health contact you 3-4 days later, maybe the phone ping you right away already. 3-4 days ago. So it's important to have that apps in your phone in order for you to know that you come close to somebody before the contact tracing call you.
Right.
Because
But
that
it
might be
doesn't
late.
seem like it's going to work if you don't find out, if the isolation team isn't calling you until 8, 12 days later. Right? If the isolation team is
Sabrina, so Sabrina, you can, if let's say that I tell you positive, rather than wait for someone to isolation to call you, you can call public health, say I'm positive. What I do with my phone now. So you can initiate that a lot faster than some isolation person will call you on your phone. You know what I mean? It's kind of help quite a bit if they do that.
Right.
But that doesn't mean that isolation team will not be able to contact you within 24 hours. That's the goal.
Was the governor, did she participate in your PAG meeting last night?
Not last night. We tried to get rid of we spent less than an hour last night because on Tuesday we spent way too long and everyone's really tired on Tuesday. So last night when we tried, so we're gonna be less than 1 hour, guys. We need to go home and take a break. So no, we didn't ask her to join her last night, but no, I briefed her this morning. What we talked about last night, and we're gonna ask public health to really provide some. And going forward to see if we can get some matrix from them just to make sure that the metric will tell us, hey, can we safely go forward? Do you have enough manpower? And it's not Guam alone. So not to say it's Guam have a problem. I think every place in the country face the same thing. It's just that we just need to kind of identify the deficit and really fix it and try to move forward, because it's going to happen again, guys. No, it's not. This is not going to be the last one, and if we have a very good isolation, contact tracing, quarantine, and case investigation, we won't be back in this same peak hole one again.
So what about quarantine? Did you guys talk about that? I mean, there's several
Yeah,
petitions that were filed in the Superior Court.
yeah, just like Dr. Lombard say, the judge really, this is own procedural. As basically public health need to make sure the paperwork is correct. The quarantine worked really well. I think from we have from day one, I think 105 plus case in the quarantine that they identify. So that helped a lot. The island surge can only happen if you have an influx of positive case in community, and that's when you travel. No, this thing just does not go around by itself. You have to bring it in. So the quarantine work, and there's no doubt about it. We will try to shorten that up from 14 days to 7 days. But that had to be planned out appropriately. We don't want to rush that because we don't want to have the recurrent mistake that we did in the past. So, but it's coming. People would like to go home faster, and we're gonna try our best to do that. Like I said, there's another app that not app, another
The Sarah
website
Alert.
that people have to sign in, the Sarah Alert that we want to roll out, and that will be required for people to sign up if they want to do home quarantine after 7 days Q factor.
Did anybody from the PAC say, Governor, leave public health alone? Don't lay off anybody, furlough anybody?
I think, I don't know. I'm not a politician, and public health need to provide all the help that they can get
Exactly.
for this pandemic. I mean, that's bottom line. You can't cut public health in any way. The governor, the legislature, no one should cut the public health. No one should cut GMH. Those are the most important entity that we can that we need in this pandemic. You cannot cut any one of those two.
All right. Thanks, Doc. Any
Okay.
final words as we head into the weekend?
We are doing better, and thank you for people to do that. We cannot get down to 100, down to 30 without community help. So again, we just ask people to be patient with the stay-home order, and again, just try not to visit your relative so much, because that's the exposure, especially again on the high comorbidity and on the dialysis patient. I keep saying that because that population right there very fragile. So please protect them.
Thank you, Doc.
All right. Thanks, Doc.
Okay.
Be safe.
Okay, and get your flu shots.
Right on.
Yes.
Okay, there you go. We are.
Okay, guys.
Get your
Have a
flu
good day.
shots available at
Be
AMC.
safe. You guys come by anytime. We give it to you. Okay, priority.
Okay.
So
Thank you.
uh,
All right.
Thanks,
You heard
Doc.
it here on
Okay.
tape. All right, see you, Doc.
you're welcome.
Okay. 722. Let's just real quick, a couple minutes with Miss Maria, the Guam Election Commission. We have public health standing by in the Zoom room.